I am Dr. Mehran Khajavi, and I am a family physician and geriatrician in Martinsburg, West Virginia. Many of you have heard of the coronavirus and have been keeping up to date with the news brought to you by your primary care, the CDC, and the World Health Organization. Today, I want to review the facts behind the virus, the necessary precaution one must take, as well as the appropriate next step should you come in contact with the virus. I believe that in order to successfully manage this pandemic, we need to view the coronavirus as a worldwide responsibility. And that responsibility starts here with us. It's up to us to join forces with medical experts and to follow their recommendations in an effort to prevent the rate at which this highly contagious virus spreads. The coronavirus is a family of viruses that can cause either a common cold or serious respiratory disease. COVID-19 is the name of the new outbreak of coronavirus that can attack our lungs. In the beginning, it can start with the common cold symptoms such as sore throat, fever, dry cough, and gradually it can get worse, and flu-like symptoms such as muscle pain, weakness, and shortness of breath can get added to the patient's symptoms. The virus is spread mainly from person to person, meaning it spreads through the respiratory droplets from an infected individual's cough or sneeze. A healthy individual can contract the virus if those droplets reaches their mouth or nose, either by coming into direct contact with an infected person or by indirect transfer of the germ through surfaces. There are two ways to protect against the virus. The first way is to maximize your health and immune system, and the second way is to protect against the spread of the germ and to maintain good hygiene as a community. Maximizing your health as an individual requires a healthy lifestyle of diet, exercise, sufficient sleep, adequate hydration, and vitamin intakes. More specifically, natural vitamin C from fruit or natural supplement that can help boost your immune system. Make sure to stay away from unnecessary stress and anxiety, especially as it relates to contracting the virus. If vigilant and consistent with taking these precautions, one is able to reduce the risk of contracting the virus. The second way to prepare ourselves and to protect our community is by taking the following steps. You must wash your hand frequently with soap and water for at least 20 seconds. This is very important. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Of course, avoid touching your eyes, nose, and mouth. The virus cannot get through your skin and can only infect you if it gets into your mouth or nose. Remain cautious and avoid close contact to account for about 6 weeks from people who are sick, especially those who are coughing or sneezing. Remember to cover your cough or sneeze with a tissue, then throw the tissue in the trash or sneeze into your elbow. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. The virus can live on surfaces such as tables, steering wheels, car keys, and cellular phones for up to several days. So it is important that you actively wipe down these surfaces. If you are sick, stay home and self-quarantine. If you have uncontrolled cardiovascular disease, high blood pressure, diabetes, COPD, chronic lung disease, or you are on chemotherapy medication, or you are on long-term treatment with corticosteroid medication such as prednisone, please make sure to contact your primary care physician or your specialist to treat and optimize your medical condition. If you are a smoker, I urge you to quit smoking, as smoking puts you in higher risk for the multiple medical problems, including lung disease. As mentioned before, the coronavirus directly attacks your lung, so please consider quitting smoking, and please contact your primary care doctor to get information and also get involved in the smoking cessation program which are available to you. If you have symptoms of COVID-19, have been in close contact with a person sick with COVID-19, or have traveled to an area with widespread or ongoing community spread, please do not walk into your local medical facility to be treated. Rather, please call the facility, notify them of your condition, and follow their guidance on next steps. If you don't have any symptoms, keep vigilant and participate in a self-quarantine. Keep away from others and remain indoors. Do not go out to public areas, partake in unnecessary travel, or ride public transportation in an effort to contain the virus and to keep our community safe. Keep a reasonable amount of food in the house and try to make warm food at home. Drink warm liquid over cold, and cook or toast food that was prepared or handled by hand, such as bakery made bread. We should not be overly worried, but rather should take this outbreak seriously and act accordingly. It is up to us to keep one another safe and to be there for the elder members of our community, as well as for those who have no access to transportation. If able, try to lend a hand to those individuals by grabbing a couple of more groceries and sanitary products. Please make sure to sanitize such packages prior to dropping them off. It is our universal responsibility to adhere to the rules in order to remain safe. Overstocking on sanitary items such as hand sanitizer does not guarantee our safety. Our safety is guaranteed when everyone has resources available to them and when they are using them in a proper and timely manner. My safety is your safety, so please buy appropriately, don't panic, and share your resources with those who have none. If we all act together, the virus will have nowhere to go. It needs us to move it and to make copies of it. If we don't help it, the virus will stop. Thank you for watching our video. All information presented was gathered from the Center for Disease Control and Prevention, the World Health Organization, and the Family Health Center PLLC. Stay safe, stay vigilant, and help our community as we battle COVID-19.